Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. In this video, what we are going to see now is infanticide. So when I say infanticide here, we are going to look at infanticide in a forensic point of view. Mainly, how a forensic person will deal with an infanticide. So all the definitions, all the things that I am talking here, it is purely in legal and forensic point of view. So the definition for infanticide is, it is same, the death of a baby within 1 year of age. When a baby dies within 1 year of age, we call it as infanticide. And filicide means if that infanticide is done by the parent. If one of the parent or both of them, if they are committing that infanticide, we call it as filicide. So this is the basic definition, and now we are going to the part, viability. So viability is ability of the fetus or the child to have a separate and independent existence away from the mother. So this is viability. So even after being taken away from the mother, it should be able to live. That physiology should be accommodating to the environmental conditions. That is viability. And period of viability, that is very important, 28 weeks. It is 28 weeks or 7 months. This is the period of viability. Now, what happens is that according to the definition of law, if a baby, if it is expelled before the term, before the actual 40 weeks, if it is expelled, or before the term, if it is expelled, we call it as abortion. And when it is expelled, what can happen is, it can be either a dead born, or it can be a live born, or a stillborn. So according to the law, if the baby, if it is dead in utero, we call it as dead born. If it is alive in utero, but it died during the labor, that during the process of the labor, while it is coming out in the birth canal, if it has died, then we call it as a stillborn. Live born is a baby that has taken a breath after coming out. Okay, this is the definition. So dead born, it is dead in utero. Stillborn, it was alive, but during the process of labor it died. And live born means it has taken a breath, respiration has happened. This is how we define the live born, dead born and a stillborn. Now, what we will do in forensic autopsy is that, so we will get a body. So we have to identify whether the baby is a dead born or stillborn or live born. If it is a dead born, we have to identify what could have been the cause of death, whether the baby is viable or not. That we have to identify. If it is a stillborn or newborn, you have to differentiate whether it has taken respiration or not, whether it was actually alive in utero and was dead before taking a breath, or it died after taking a breath. That thing we have to analyze and give report. And if we say it has taken a breath, that it was a live born and it has died after taking that breath, what could have been the cause of death and what could have been the age of that baby. All these things we have to find out in the autopsy. So first thing, whether it is dead or alive. This is the first thing you will look for. Then you will find out the viability of the child. What is the age and whether it is viable or not. And if it is found viable, we will try to look out the cause of death. And once we found out the cause of death, we have to identify the age or the survival period. All these things we have to identify using the autopsy. So this is what we primarily aim at in case of a infanticide or a fetal death. So now when we say dead born, what happens is that it will be dead inside the uterus, right? So there are certain radiological signs that we can use to identify a dead born. And what are the radiological signs? The very first sign is absence of heartbeat and movements. This is the very first sign that you can see. After that, you can see something known as paddling sign. So this paddling signs means there will be suture overriding. That is your skull bones. It will just go over each other. There will be overriding of the skull bones. That is paddling sign. Next you have Roberts sign, which is air in aorta. Then you have halo sign. In halo sign, what you will see is there will be a halo over the head of the dead born. So this halo is what? It is actually due to the separation of subcutaneous fat from the scalp. So this layer, it will look like a halo around the head of the baby. So these are the most common radiological signs that you can see in a dead born. Apart from that, you will also see hyperflexion of spine and overcrowding of ribs. All these signs you can see in case of a dead born radiologically. So this is how you identify whether a baby is dead in utero or not. Now, after we take the baby out, there are certain criteria that the baby has to fulfill to be called as a dead born. So when we call dead born, so to say dead born, it must have at least one of these following characters. That is, there should be maceration or rigor mortis or putrefaction. It can be either mummification or adipocere formation. So if the baby is having at least any one of these characters, then only we call it as a dead born. So this maceration, we know it is an autolytic condition. So maceration, it is a complete autolysis process, and this maceration is what you commonly come across. Like what will happen is that the very first sign of maceration is there will be reddening of skin, and this will occur by 12 hours, and following that you will have bleb formation in the skin. That is due to blister formation. You will be seeing these blebs, and this will happen by 24 hours, and it will keep on happening. This autolysis process will keep on going, and at the end what you will get is a pulpy fetus. It will completely liquefy. So you will get a very soft and pulpy fetus. Now, why we are getting to know about all these features is that, like sometimes there can be some mishaps. What will happen is that somebody, they will come to the labor ward and they will say that I want to get labor and having the labor pain. So you will be admitting them, and while conducting the labor you will be seeing that the baby is a dead born. Then what they can do is, the people, they will come and complain that the baby was well alive when it was inside my body, but while doing the labor, while conducting the labor, you did something wrong, so my baby died. It is your wrongdoing. Like that they will allege. So in that condition, if you see any of these maceration features, then you can definitely say that the baby had been dead for at least 12 hours. Nothing had happened in the hospital. There was no delay in the treatment. There was no mishandling of the baby. Nothing had happened. It had happened already in utero. Like that you can prove yourself. So, to prove ourselves in such condition, we have to know all these changes. And if it is kept for a very long time inside the uterus, we get something known as fetus papyraceous. So, this fetus papyraceous is the baby, it will liquefy, become soft, and once it keeps on entering the uterus, what will happen is that it will become flat like a paper. So, you will completely lose everything and it will become like a paper. That is what we call it as fetus papyraceous, and this will happen after weeks. After a lot of weeks, you will be getting to see this condition. And sometimes what will happen is that you will get something known as lithoperion. So, lithoperion is something we call it as calcified baby or fetus. So, when this baby is left inside the abdomen for a very long time, it will become calcified and we call it as lithoperion. So, these are the important signs of maceration that we have to know. So, it has to have either maceration and rigor mortis we can easily appreciate. Next comes the putrefaction. So, this putrefaction, it usually happens if there is any rupture of membrane, if there is any possibility that air enters the cavity. If air enters uterine cavity, this putrefaction will happen, and if there is adequate amniotic fluid, the putrefaction will modify into adiposity. If there is very scanty liquid, then you will get mummified fetus. So, mummified fetus will be getting. So, if the baby is showing any one of the feature when you take them out, either maceration or rigor mortis or this adiposity or mummification, then only we can say that it is a case of dead bone. So, with dead bone, you will find out whether it is a dead bone or live bone, and once you found out that it is a dead bone, all you have to do is you can say the age and what could have been the cause of death inside for further prevention. So, this much we can say and there is no issue. So, this is ending of the dead bone. After that, what happens is that you get stillborn or liveborn. So, in stillborn or liveborn, what will happen is that this baby, when it is getting delivered inside the vagina, it may cry. So, this is known as vagitus vaginalis, and it may cry inside the uterus. So, this is vagitus utralis. So, this crying may happen inside, but when it is completely born, it may not cry. Even those children, it will be considered as a stillborn. According to the law, the baby has to be born completely, like all the parts should be taken away from the mother. After that, if it takes a breath, then only we will consider it as a liveborn. Now, what will happen is that we have to identify whether respiration has taken place or not. To identify this, we have certain autopsy procedures and techniques and tests. So, the main point of identifying respiration is to find out whether it is stillborn or liveborn. So, first, the autopsy procedure. The type of incision that we use in infanticide is inverted Y-shaped incision, and organ removal technique that we normally use is rocket and sky. It is in situ dissection. So, these are the most commonly used autopsy technique, and cavity opening is very important. Usually, we open the head first, and in case of these death, we have to know whether respiration has taken place or not. That is our primary motive. So, to find out that, what we have to do is, we have to open abdomen first. So abdomen should be open first, and after that only we can open the thorax. Why? Because in the abdomen we have to visualize the level of rib, of diaphragm. So the diaphragm, at which level of rib it is placed, that thing we have to know. Generally, if it is in 5th to 6th rib, it means it has not taken respiration, it not respired. And if it is between 6th to 7th rib, means respiration had happened. So this is how we identify whether respiration had happened or not. If we say respiration happened, means it has to be a live-born. If respiration had not happened, it is a case of stillborn. So to identify that, we usually open the abdomen first, then only we will open the thorax. So this is the order of opening the cavity in case of infant death. Now, there are certain other signs of live birth that we can see. So first, starting with the lung changes. If it is a live born, you will have more pink color, while in case of dead born, it will be very pale, and margins will be more rounded here, while here it will be very sharp. Here it will be very much crepitant, here it is not crepitant. And rib level, I already told you, it will be 6th to 7th rib, while here it will be 5th to 6th rib. So this is in the general appearance of the lung. Apart from that, when you cut open the lung, this will be very frothy along with blood. Here you will have very little amount of blood, but there will not be any froth. So this is how we usually differentiate externally how a live born and dead born lungs will look like. Apart from that, we have two other tests. One is your Foder's test, another is your Placard's test. So Foder's test, what will happen is that when respiration happens, when there is respiration, there will be entry of blood into the lungs. So the lungs will be fed with blood. So entry of blood into the lungs. So what will happen? Because of this entry of blood, weight of the lungs will increase. Weight of the lungs will increase. So this is the Foder's test, meaning it will increase from 35 to 70 grams. So the weight of the lung will increase once respiration takes place because of feeding of blood inside the lungs. So this is your Foder's test. Up next, what we have is Placard's test. So here what happens is that since the respiration increases if the respiration happens, the weight of the lung is increasing, what will happen is that the ratio of body weight to lung weight, it will reduce. So it will from 170, it will become 135. So this ratio will reduce because of the respiration. Feeding of blood into the lung will increase the weight of the lung. So by using this, we can identify whether respiration has taken place or not. Next comes the most important test known as hydrostatic test or Rayagat's test. So this is also known as hydrostatic test. So the principle that we use here is the principle of specific gravity. Specific gravity principle is what we use here. So Rayagat's test, what we have to do is, we have to take the lung and heart bunch, and we also have to take piece of liver. So you need to take these. So now what you have to do is, we have to have a water filled container. Now what you have to do is, you take all these things. So you will put this lung bunch and liver inside the water. So it will be put inside the water. If the lung is floating, then it means it is positive. If the liver sinks, then you can go ahead with the test. But if liver is also floating, then you should not conduct the test. Why? Because ideally if there is air inside the lung, it should float because of the specific gravity. It should float in the water. Lung, it will float. But liver, it is a solid organ, right? It does not have any air. So, it should sink. This is what normally happening. But because of putrefaction, if there is air in the lung, air in the liver, what will happen is that this liver will also start to float, meaning putrefaction has taken place. So, there is no way that this test will give you a meaningful result. So, there is no point in conducting the test. You will just leave the test. So, this is the initial point. So, now liver is sinking, your lung is floating. So, this is the first step. So, first step done. Now, what you have to do is, you have to separate the lung. You have to separate the lung, then again you have to put it in the water, and if it floats, what you have to do is, you have to make lung into multiple pieces. So, multiple pieces must be done and it should be put again in the water, and even after that it floats, what you have to use, you have to take the pieces of lungs and squeeze them. Squeeze the lung pieces and put it again inside the water. Even after that, if it is floating, that means it is positive Rayagat's test. Positive Rayagat's test, meaning the respiration has taken place. Respiration has taken place. So, why we are saying this is that, like all this cutting into pieces, squeezing them, all these things, why we are doing is that this is mainly because there may be some residual air present in the lung. Because of some artificial respiration or some other thing, residual air will be present in them. By squeezing them and by cutting them into pieces, we can remove all the airs. So, this is mainly to remove the residual air. So, residual air will be removed, but it does not remove the alveolar air. So, alveolar, if you have air, means only by respiration air can enter alveoli, right? So, if alveoli it is having air, means it will float even after doing all this squeezing and all. That is why we go through all this process. Initially, we will take the lung bunch, then we will separate the lung, then we will cut the lung, and we will squeeze the lung pieces, and even after all this, if it is floating, then means it is a positive Rayagat's test and respiration has taken place. So, this is how you do this Rayagat's test, and this Rayagat's test, it is depending upon the principle of specific gravity. But there are certain fallacies to this Rayagat's test. Fallacies to test. What is this is that there may be false positive. So, false positive means respiration did not take place, but this Rayagat is becoming positive. So, it is falsely becoming positive. This can happen when there is putrefaction or if there is any artificial respiration. So, these are the two important reasons why the test can become false positive. Next, it can become false negative. So, why it can become false negative? Like it has actually live baby, it has taken respiration, but still the Rayagat will show negative. Why? Maybe the respiration was very feeble. It was a very feeble effort, or there may be some lung pathology so that the alveoli could not expand properly, like pneumonia or any atelectasis. So, any pathology that will prevent the expansion of the alveoli can give you false negative Rayagat's test. So, that is why you have to make sure none of this has happened. If you want to rely on this Rayagat test alone, you have to do it properly, and even after doing it properly, this false negative and false positive thing may happen. So, this Rayagat's test It is very, very important and it can be asked as a short note. This is very, very important in this infanticide chapter. And up next what we have is few other tests. So, first test is we will check for air in stomach. This is also known as Breslau's second life test. So, this is Breslau's second life test. So, what you have to do is you will tie the stomach and you will remove it. Tie the stomach at both ends and you will remove. And after removing, you will put them inside the water, and if it is floating means respiration has taken place. So, this is one test. Next what we will do is we will look for air in middle ear, and this is known as Braden's test. So, this is known as Braden's test. And how you will look for this? You will place the ear under water. So, ear will be kept under water and you will puncture the eustachian tube. Okay, you will puncture the tympanic membrane. You will puncture the tympanic membrane, and if there is any air present in the eustachian tube, it will come out of the tympanic membrane like a bubble. So, if respiration had taken place, there will be air inside the middle ear. So, these two we will use along with the Rayagats to find out whether respiration has taken place or not. And apart from that, we will also look for the changes like umbilical cord changes or presence of any foreign body in stomach. All these things we will be looking for. And the surest sign of live born is, first thing, milk in the stomach. Milk or some sort of foreign body in the stomach, it is a surest sign of live born. Or if you see any inflammatory changes, any sort of healing, those kind of changes if you notice in the body of the baby, especially in the umbilical cord, you can say that is a surest sign of live born. So, these are the important things that we have to know in this infanticide chapter. So, dead born you will easily identify by seeing either maceration, rigor mortis or putrefaction has happened. And apart from that, the radiological sign that can use to identify is absence of heartbeat, there will be spattling sign, there will be overriding of the skull bones, halo sign, separation of subcutaneous fat from the scalp layer, then you will have the air in the aorta, which is Roberts sign. Apart from that, there will be hyperflexion of the spine and overcrowding of the rib. All these are signs of dead born, that is dead in utero. Next come the stillborn versus live born. The only way to differentiate these two is by doing whether respiration has done or not. That test we have to do. So, you will look for lung changes, any morphological changes in the lung you will look for. After that, you will do certain tests like Foder's test where the weight of the lung will increase. Placard's test, that also increased weight of the lung will be put in a ratio. Then Rayagat's test, the very important test which acts on the principle of specific gravity. And there are certain fallacies to this Rayagat's test. So, that thing also we have to know. And finally, you have two other tests, that is Breslau's second law test where you will look for air in the stomach, and Braden test where you will be looking for air in the middle ear. So, using this you can say whether respiration has taken place or not. And surest sign of live born, if there is any milk or foreign body present in the stomach, then we can say it is a surest sign of live born. Otherwise, if there is any inflammatory changes you are seeing in the body of the baby, especially the umbilical cord if you are seeing, then you can say that it is a case of live born. So, using all these, you can differentiate a dead born, live born and a stillborn. Now, next after that, you have to identify whether the baby was viable or not. So, you can identify by using the age identification. So, you will have to identify what is the week of gestation that is seen in that baby. Now to identify the age, to identify the gestation week, we have two methods. One is by looking at the length of the fetus. So this is known as rule of Hasse. We will take the crown heel length, the whole length of the baby we will take, and we will find out the gestational age by measuring this length. How we will do is, if it is less than 5 months, we will do square root of this crown heel length, and if it is more than 5 months, if it is less than 5 months, we will do this. If it is more than 5 months, what we will do is, we will divide the crown heel length by 5. So this is how you will get the age of the fetus. For example, if it is a 25 centimeter, then you will do square root, you will get 5. So it is a 5-month-old fetus. Like that, you will usually identify the age of the fetus. So by looking at the age, we can say whether it has crossed that period of viability or not. If it has crossed that 7 months, then you can definitely say that it is a viable baby. Like that, you can identify the viability. Otherwise, what you can do is, you can go and dissect for the ossification center. So ossification center will be dissected, and we can see the, like if it is the bone, and you can see the ossification center as a small red point. This is where the ossification will start from, and the main ossification center that we have to know is thallus, calcaneum, and lower end of femur. This thallus is very important. It is 7 months. Okay, thallus is 7 months, calcaneum is 5 months, and lower end of femur, this is will indicate the term, because this is end of 9 months. So if it is a term baby, it will definitely have the ossification center appearing at the lower end of the femur. So by looking at the length, that is crown heel length, not crown rump length, you have to take crown heel length, and by looking at the appearance of this ossification center, we can definitely find out the age of the fetus and find out the viability of that fetus. So you have find out whether it is alive or not. Now you have find out whether it is viable or not. Next, what you have to do is, you have to find out the cause of death. So cause of death, if there is anything, any abnormal pathology or any foul play, you have to look for them. If they have done any act of commission or omission, like they have tried to smother the child, or they have inflicted any injury over the child, or they have injected something, any injection given to the child, like that, if they have neglected, something like that had happened, you have to identify and you have to give the cause of death. So these are the things you are required to do in case of a fetal autopsy and infanticide. So whenever a fetus or infant is brought to you for autopsy, the first thing that you have to find out is that the baby is viable or not. And after that, you have to identify whether it is a live born, dead born, stillborn. And if you identify that as a live born or a stillborn, what you have to do is, you have to find out whether any foul play was there or not, whether the baby was intentionally killed. So all these things you have to do in an infanticide autopsy. Clear? So next, what we are going to see is child violence. So child violence, this is something known as battered baby syndrome. There are other names for this, that is cafe syndrome or non-accidental trauma So these are the other name for battered baby syndrome. This is a child abuse, mostly physical. Sometimes there may be psychological or sexual abuse also. So there will be abuse of the child. And what are the features that you usually see is that there will be no corroboration between the history and injury. Like a baby which is very small, like 4 months, 5 month baby, they will be coming with femur fracture. So those kind of, they will say the baby, it tried to crawl and it got the femur injured, like that they will say. Or they will be coming with lot of injuries, multiple injuries, with multiple age. Like there will be abrasion, there will be bruise, there will be laceration. Everything will be seen over the body, and each and every injury, it will be seen in different ages. Something will be 2 days old, something will be 1 month old, something will be a week old. So like that you will be seeing multiple injuries in multiple ages. Sometimes you will be seeing certain classical injuries. So what are those classical injuries? So first is your frenulum tear. So tear of frenulum, that is very classical. And cigarette burn marks, that is also classical. Then you will have slap mark or butterfly mark. Butterfly mark means it is due to pinches. They will pinch the child and it will look like a butterfly shaped bruise. So this is the classical thing that you will find in the body. Along with that, you will find something known as bucket handle fracture. So this is your bucket handle fracture, where you will be, see here, do you see this? This is the bucket handle appearance. This is basically a metaphyseal fracture. And this fracture, it is very typical of this battered baby syndrome. Apart from that, what you can see is string of beads appearance. So this is something you will be seeing in the paravertebral gutter. In paravertebral gutter, you will be seeing string of pearl appearance. That is mainly due to formation of callus after rib fracture. So during the healing of the rib fracture, you will be getting to see this callus formation in the paravertebral gutter, which will look like a string of bead. So all these things, they are very classical of the battered baby syndrome, and this is how it will look like. See, along here you will be looking the callus formation, and it will look like a bead, like a pearl bead, something like that. It will look like a string of bead appearance. So now this battered baby syndrome, just by looking at all these injuries, all these things, you cannot simply diagnose. You have to rule out all other pathological conditions. After ruling out all these pathological conditions, where people may have brittle bones, they may be easily bruised, they may have some hemorrhagic disorder, all these things you have to rule out. Only after ruling this out, you can say that it is a case of battered baby syndrome. This is very important. Before ruling out, you cannot accuse somebody of battering the baby. So this is the important thing. Next up, what we have is shaken baby syndrome. We call it as SBS. So here what will happen is that there will be violent shaking of baby. There may not be any other bodily injury, but simply they will be shaking the body very violently, so that the baby will end up with intracranial hemorrhages like STH. It can get STH, then intraocular hemorrhages and cerebral edema. So all these things can be seen in the shaken baby syndrome, and this is very delicate thing. Only because of this violent shaking, they will be getting all these, and they may even present with some minor to major neurological deficit. So there will not be any other injury. Just by shaking the baby violently, they will end up with these conditions. So this is shaken baby syndrome. Now comes something known as Munchausen by proxy. So here what happens is that what they will do, they will intentionally harm the child and they will admit the child into some hospital. So when they are admitting the child in the hospital, everybody will come and take care of them and they will enjoy that attention. That is Munchausen by proxy. So the simple Munchausen syndrome is, if it is Munchausen, they will do self-harm. They will harm themselves and they will get admitted and they will enjoy the attention. But this Munchausen by proxy, it is usually done for the children. They will harm the children and they will enjoy the attention. And it is usually diagnosed in the hospital. When you separate baby from the caretaker, all the symptoms, all the injuries, it will fade away. And once you put them back together, it will come back. So separate the baby will be cured. And once you put them back together, the baby will suffer from the same condition again. So these are the ways by which the child violence can happen. First is your battered baby syndrome, otherwise known as cafe syndrome, which is a non-accidental trauma of childhood. And what you can see is, like, there will be certain special features like no corroboration between history and injury, multiple injury in multiple ages, metaphyseal fracture also known as bucket handle fracture, and the string of bead appearance where you will be seeing the callus formation in the paravertebral gutter. Then you can see the frenulum tear, cigarette burn marks, slap mark, butterfly bruises due to constant pinching. So all these things can be seen in this. Next is shaken baby syndrome, where because of violent shaking there will be cerebral edema, SDH and intraocular hemorrhages. So all these things will be seen in the shaken baby syndrome, and they may even present with some minor to major neurological deficit. Next is Munchausen by proxy, where the caretaker will injure the baby intentionally and they will enjoy the attention. So this is Munchausen by proxy. So these are the ways where child violence can occur. So after that we have one phenomenon that is known as SIDS, that is sudden infant death syndrome. This was a very old term. Now this term is replaced by sudden unexpected death of infancy. This has explained and unexplained. Now this is the term that is being currently used, that apparently a well child, it will be found deaths all of a sudden. So that is the SIDS. Like, this is mostly a diagnosis of exclusion, like you will do all the investigation, but even after that you will not be able to find the cause of death. Then only you will label the death as SIDS. And nowadays we are calling it sudden unexpected death of infancy, and if you are finding the cause of death, we will call it as explained SUDI, and if it is unexplained, like the cause of death is not found, we will say it is SUDI unexplained. So this is the term that we are using now, and whenever you come across these SIDS, history is very, very important. Especially you have to ask for any major or minor life-threatening event. Like the baby, they could have suffered from some URI, they could have suffered from any cyanosis or any unconsciousness episode or any seizure or something major or even minor. If baby is suffering from something significant, that history has to be elicited. And co-sleeping, that history has also should be taken. So this history is very, very important in case of this sudden unexpected death of infancy. And most of the cases you won't be able to find out the exact cause of death. But if you do histological analysis, if you do certain biochemical analysis, you may be able to find out the cause of death. There may be some genetic condition, there may be some minor URI which is leading to apnea. So all these things, if you do thorough investigation, especially histopathological investigation, you will be able to find out the cause for this SIDS. So with this, we are finishing the infanticide and child violence chapter, and next what we are going to see is abortion. So abortion, the first thing that we are going to see is medical termination of pregnancy. So medical termination of pregnancy. Usually abortion, it can be either spontaneous or induced, and if it is induced for some medical reasons, we call it as MTP, and it is completely legal when it is done for certain reasons. So first reason is if it affects the mental and physical well-being of the mother. If it is an emergency to the mother, like it is affecting the mother's health, you can do MTP. Or if it is affecting the physical well-being of the fetus, like the fetus is having some congenital anomaly, under that condition also you can do MTP. Next is contraception failure, and if the pregnancy is due to rape or incest. Under these 4 headings, you can do legal MTP. You can legally terminate the pregnancy. And for doing the MTP, according to the MTP Act, you have certain conditions. So first is that duration and requirement. Up to 20 weeks, all 4 we can do, and we need only 1 RMP. And if it is between 20 to 24, you can do it for 1, 2 and 4. Contraception failure you cannot do, and for 1 and 2 there is no time limit, any time you can do, and for this second one you need 2 RMP, and this for last one you need a medical board approval. So these are the criteria that has been given in the MTP Act and amendment, recent amendment this is made. So up to 20 weeks, all 4 reasons you can do MTP, only 1 RMP is needed. Between 20 to 24 weeks, you can do except for this contraception failure, and you need 2 RMPs. And between any time, for first and second reason, that is for wellness of the mother and for the congenital anomaly, you can get approval from the medical board and you can conduct MTP. So this is about the MTP Act, and now it is done by the doctors under careful consideration. It is the legal abortion, but there are certain conditions where illegal abortion takes place. So beyond the purview of MTP Act, if abortion is done, we will call it as illegal abortion, and this illegal abortion is mostly done in some illegal pregnancies. So what are the methods that they usually use for illegal abortion? We are going to see. Why we are going to see is that, like, these illegal abortion, they are most commonly done by quacks, like people with certain experience but not full knowledge. So this can always endanger the life of the mother. So that is why this illegal abortion is very, very important. And what are the methods that they usually use is, up to 1 month they will do some violent exercises. So they will do lot of violent exercises and they will try to abort by themselves. After 2nd month, what they will do is, they will take some drugs. So they have some medical methods, right? All the medical methods, contraception they will be using to abort the baby. Afterwards, once second month, third month is crossed, what they will do is they will look for some mechanical methods. So that is how the illegal pregnancy, illegal abortion is performed. So first method that they usually use is ecbolics. So ecbolic is something which will increase the uterine contraction. So this thing, it will increase the uterine contraction, but it will not open the cervix. So cervix dilatation will not happen, only uterus contraction will increase. This can in turn cause lot of damage to the mother. And the most common drug used is ergot and apiol. Sometimes they will use some synthetic hormones like estrogen and abortifacient agent like lead and quinine. So all this lead, quinine, everything itself, they are very toxic products and they can die because of systemic toxicity. And if they are using this ergot, this will cause arterial spasm. So this will result in arterial spasm and it will result in gangrene of limbs. So it can result in gangrene of lot of parts. So this is why the ecbolic is highly dangerous. Apart from ecbolics, what they will do is they will try to use emmenagogues. So emmenagogues are something that will increase the menstrual flow. So all the things, all the native medicines, whatever they can find, all the organic products, they will try to use, or sometimes they will even take the iron tonic and all to just to increase the menstrual flow. So this is the emmenagogue technique. What next they will do is they will apply irritants in the genital tract. It can be either local application and sometimes they will apply in the systemic also, like generally all over the body, like they will intake, they will ingest the irritant. So local application, it is usually confined to the vagina, and because of the local irritation, they think the baby will come out because of cervical dilatation. And systemic, what they commonly used is this cantharides and potassium permanganate. This cantharide, it is a very strong irritant. It can result in kidney failure. So cantharide, it can result in kidney failure, and this potassium permanganate, it can erode the artery resulting in severe hemorrhage. So the patient, they may die of hemorrhage. So this is the usage of irritants. Now what they will use is they will use GI irritants. They will take something that will lead to diarrhea. So what they think is they will increase the activity in the colon, which will in turn affect the uterus contraction. That is their idea. So if they have increased activity of the colon, the uterus contraction will be activated, thereby aborting the fetus. That is the idea behind using GI irritants. So they will use emetic, cathartics just to release the colonic substances, and sometimes they will use this castor oil, croton oil and senna, which are like very potent GI irritants, and they themselves can cause systemic toxicity. So this can result in death of the mother. Sometimes what they will do is they will take these systemic poisons and apply them locally, like inorganic items like your lead, mercury, all these things they may apply locally, and organic things that like they will have this papaya, all the artificial bruise causing agents, like all the medicines, all the native medicines, they will be taking them orally and they will try to abort the child. So all sort of things they will try. And finally, if none of this is working, they will resort to general violence. They will do some violent exercise. They will hit themselves. They will exhaust themselves. All the general violence will be tried. And one important violent method is cupping. Here what they will do is they will make a, like they will light up a wig, like some candle or something, they will light up a wig and they will put it in the abdomen. A small candle, like they will put it in the abdomen, and over that they will put mug. Over that they will put a mug, that is a cup. And once the fire keeps on burning, there will be production of gas, oxygen, right? So oxygen will come, and then it will create a vacuum. So now what they will do is they will slowly move the mug. So because of the vacuum, they think it will separate the placenta from the uterine attachment. So they will rotate and pull the mug, which will cause separation of placenta. So separation of placenta will happen and thereby abortion will happen. So this is the theory beyond cupping. So this general violence, cupping, they may try. Otherwise what they will do is local violence they will try. They will like hit themselves over the local region, over the genital region they will try to hit, or what they will do is they will put air inside the vagina. So there will be air insufflation. They will syringe air inside, and like sometimes it may result in air embolism and the mother will die. So all these local violence and general violence they may resort to. Next what they will do is they will do something known as abortion stick. So this is mainly for cervical dilatation. So they will take a stick like this, and at the end of the stick they will put some cotton, and in this cotton they will apply all the abortifacient, all the important abortifacient like abrus, arsenic, asafoetida, mercury chloride, cerebra thavacia, nerium odorum, all the irritants, all the abortifacient they will apply in this wig, in this cotton wig, and they will insert into the vagina. So this will reach the cervix, and because of the irritation the cervix will start dilating and the conception product will get down. So this is the theory behind using this abortion stick. Otherwise what they will do is they will dilate the cervix using this laminaria tent and slippery M bar. So what they will do is these are basically organic products, these are from the plants, okay. They will take these and they will insert it inside the cervix. So insert into the cervix, and what these two will do is they will absorb water, and they will swellen. So as it keep on swelling it will dilate the cervix mechanically. So that is what they will try for. So they will either use abortion stick or they will use this laminaria tent and slippery M-bark thing. Sometimes what they will do is they will apply electricity to the lumbar region. So they will apply electricity to the lumbar region, very minimal, and by applying that they think it will increase the uterine contraction. It will initiate or increase the uterine contraction. So all these methods they usually do for illegal abortion. Now comes the most dangerous part of illegal abortion. What they will do here is they will rupture the membrane. So they will use some sharp object and they will themselves rupture the membrane, which will result in the abortion. So this rupturing membrane, it can lead to septicemia, and sometimes emboli can also happen. So embolism can also result in death of that mother. So this rupturing of membrane, it is very dangerous. Next to that what they will do is syringing. They will use this thing, it is known as Higginson's syringe. So here what they will do is they will instill air into the uterus, and through that they will try to abort the fetus, and this is very dangerous and it can result in air or amniotic fluid embolism. So air or amniotic fluid embolism, this is very common with this syringing. Of all the illegal methods, these two are highly dangerous and they can result in instantaneous death. Now apart from that, they will procure this manual vacuum. Okay, they will do vacuum, or they can do DNC, dilatation and curettage. This also will be done by few quacks, and all these methods they can cause death. What is the most common of death is that it can be due to septicemia, or it can be due to air embolism. It can be due to amniotic fluid embolism. or it can be due to hemorrhage, or the irritant that they used. It can result in systemic toxicity. So, all these things can result in death in case of an illegal abortion. So, starting from this, see, first they will use the ecbolics, which will increase the uterine contraction. Then they will use the emmenagogue, which will increase the menstrual flow. Then irritant of genital tract, GI tract irritants. Then systemic irritant, systemic poisoning they will use. Then there will be application of general violence, local violence. Then usage of abortion stick, this laminaria tent and slippery embark for dilatation of the cervix, or applying electricity to the lumbar region to initiate uterine contraction, or rupturing of the membrane, and syringing. All these things are usually done to cause illegal abortion. And whenever a case of illegal abortion comes to you, the most important thing you have to do is crime scene investigation. This is highly important in those cases, and depending upon the history, you have to change your autopsy technique. So, if they had used some irritant, you have to look for findings that will be caused by the irritant. If they had used some syringing or something, you have to look for the finding that will be caused by the embolism. Like that, according to the history, you have to change your autopsy technique. So, this is very important with this abortion. So, next come impotence. So, first impotence, what we mean by impotence is that it is inability to get gratification or perform sexual intercourse. So, this is impotence, and this impotence, it is a ground for nullity and divorce. So, nullity means, it means like marriage never happened. It will become like marriage never happened between these two. They will completely nullify the marriage. Divorce means the marriage had happened, but hereafter that marriage is not valid. So, this is the difference between nullity of marriage and divorce. And this impotence, it is a very strong ground for nullity and divorce. So, this is impotence. Next, what is sterility? Sterility means inability to procreate, to inability to bear an offspring, that is sterility. It is seen in both male and female. Next, what we have is frigidity. So, this is reluctance by female towards sexual activities. Like they will not take part in the sexual activity, that is frigidity. Nymphomania is, there is like increased sexual activity, especially in female, that is nymphomania. Satyriasis is same as nymphomania, but it will be seen in males. So, it is counterpart of nymphomania in males. So, these are the general terms that we have to know here. And now, next we are going to see about surrogacy. So, surrogacy in India, it is done using following this Surrogacy Act. So, according to this act, who are all eligible for surrogacy is, they must be a married couple with proven infertility. So, this is 5 things, and they must be married for 5 years, and they can be a single widowed female. So, these people, they can opt for surrogacy, but the thing is, a single male, a widowed male or a gay couple, they cannot opt for surrogacy. Only a married couple or a widowed mother can opt for surrogacy, and they must be married for at least 5 years, and they should have proven infertility. Only after fulfilling all this, they can go for surrogacy, that too only altruistic surrogacy is allowed. Meaning you can go pay somebody and ask them to be a surrogate. So you have to do it for greater good. Like it can be done free and it should be done only by the kindness of the heart. You should not get money and do it for like money. So this is the important thing with this Surrogacy Act, because lot of people were getting exploited by this. So this Surrogacy Act made sure that only couple with proven infertility married for a minimum period of 5 years can offer surrogacy, and that too altruistic surrogacy is allowed. And what they have to do is that like they have to pay for medical expenses and any complication that is arising out of pregnancy, or for all that also they have to pay money by the couple. So the money will be paid by the couple. So this is the only money where you will be giving to the surrogate mother. No other money will be given. And for being a surrogate mother also there are certain criteria that has to be fulfilled. So that is, this surrogate mother have to be a blood relative of either of the biological parents. This is very important. She should be a relative of the parents. At least for one of them she should be a relative, and it should be less than 35 years of age, and they should have at least one live child, and they should not take any money except for medical expenses. So these are the criteria for surrogate. Except for medical expenses, they cannot get any money from the biological parents. So by following all these criteria, they have to follow this altruistic surrogacy. So this is about the Surrogacy and Surrogacy Act. Apart from that, you also have something known as artificial insemination. So here what will happen is that you have to get consent of both husband and wife, and you will do the fertilization in vitro, and you will implant the embryo. Now for fertilization you can use the homologous, that is the biological parents' sperm and egg, or sometimes you can use donor, like donor sperm would be used. Sometimes they will do both, okay, both will be used. So this kind of artificial insemination is also done, and it should be done only after getting due consent from both husband and wife, and the baby that is being born out of this insemination, they will be considered legitimate. They will have all rights. So this is the thing about artificial insemination. So next comes the signs of pregnancy. So signs of pregnancy, there are three signs. You have presumptive sign, then you have probable sign, then you have positive signs. So this presumptive signs mean it may be 25% chance for pregnancy. They are very preliminary. It can be like even in case of like a false feeling of pregnancy, which is known as fictitious pregnancy, they will have these symptoms. So just because someone is having this changes and symptoms does not mean that they are pregnant. It is only 25% possible that they may be pregnant. So the first earliest sign is amenorrhea. This is the first sign, and you have to rule out all other pathological conditions. All other pathological conditions should be ruled out before you say that it could be due to pregnancy. So next, there will be lot of breast changes. So and these breast changes, they are more prominent in the priming rather than a multigravida. So initially it will start with tense and tingly breast, and later on it will increase in size, and they will have a lot of nodularity. like this nodular appearance will happen due to the hypertrophy of the breast gland. So, this nodularity will be appearing in the breast, and what will happen is that this nipple and areola, they will increase in size and they will become darker. There will be discoloration of the nipple and areola. So, this is also seen in the breast. Next to that, you will get something known as Montgomery tubercles. So, here what will happen is that the sebaceous gland in the areola, it will increase in size. So, here do you see this? These are the Montgomery tubercles, and this is very typically seen in pregnant ladies, and by 6 months, because of the enlargement of the breast, you will be able to see these striae. It will look like a silver line in the breast. All these changes are seen in the breast, but still these changes are considered only presumptive. Next, you will be getting hyperpigmentation. So, hyperpigmentation, it can be melasma, which is also known as mask of pregnancy. Then you will also be getting nigra, that is the linear black discoloration over the midline. So, these hyperpigmentation will happen in pregnancy. Apart from that, they will be experiencing extreme fatigue and morning sickness. So, all these are presumptive signs, not exact like positive signs. After that, what we can see is quickening. This is due to body movement of the fetus. They will be experiencing this quickening. Then there are certain vaginal signs that will be seen. So, first is your Chadwick sign. Here what will happen is that you will have bluish hue of the cervix. The cervix, it is initially rose in color. In pregnant ladies, it will have this purple bluish hue and we call it as Chadwick sign. Apart from that, you will have a flattened anterior wall of vagina and you will have soft vulval and vaginal tissue and increased mucus secretion. These are also seen in the early stages. And next comes the probable signs. So, probable signs means at least 50% chance that the lady is pregnant. So, first is your enlargement of abdomen. You will have distension and there will be increase in the size of uterus. You will be able to palpate the uterus and there is something known as Hagar's sign. So, Hagar's sign means like during the bimanual palpation, you will be able to palpate the isthmus, that is your lower uterine segment, which will be very soft. This is known as Hagar's sign. First we saw this Chadwick sign, which is bluish discoloration of the cervix. Next we have the Hagar's sign, where bimanual palpation of the uterus, you will be getting to feel a soft isthmus. So, this is another sign. Next we have shortening of the cervix. Then the orifice, it will become circular. Initially it will be longitudinal in case of like nulliparous, and when the mother become pregnant, it will become circular and you will be able to admit the fingertip. It will be able to be inserted easily into the cervix. And there is something known as Goodall signs. This what you can do is that in the Goodall signs, you will be able to see the softening of the cervix. So, this is your Goodall sign. Then Braxton Hicks contraction. These are rhythmic uterine contractions that happen well before the term, and these are also known as false pain. It is not labor pain, it is a false pain. And next is your Osiander sign, where you can feel pulsation in the lateral fornix. So, Hagar's sign, Chadwick sign, Goodall sign, now Osiander sign, where you can feel pulsation in the lateral fornix. Then you can see Palma's sign, the rhythmic contraction of the uterus can be felt. This is Palma's sign. Then uterine souffle is the soft blowing murmur due to blood flow in the umbilical cord. So you will be getting to see the soft blowing murmur like sound known as uterine souffle. And this HCG, it will be increased. So these are the probable signs of pregnancy. Next to that, what we have is the positive signs, where you will be able to appreciate the fetal movements and fetal parts. Everything will be able to appreciate, and we will also be hearing the fetal hearts. So you can, using this step, you can hear the fetal hearts and placental souffle. Like the same, the movement of the blood towards the umbilical cord to the placenta, you will be able to hear. So this is also a murmur due to blood flow. And in ultrasound, you can actually visualize the fetus. So these are the positive signs of pregnancy, and there is something known as microchimerism. This is like the cells of fetus. It can be seen in mother's blood. So this is microchimerism, means this traversing blood cells from the fetus to the mother. This is also a positive sign of pregnancy. So you have presumptive, probable and positive signs. So only the movement part and fetal heart sound, all the movement part and fetal heart sound feeling is called as positive sign, not HCG, not this quickening, not the false spine. Nothing is a positive sign except for these. Now, the important aspect of medico-legal aspect of pregnancy is that there can be pseudocyesis, or known as fictitious pregnancy. Like some people, they may think that they are pregnant. So because of this thought, they will experience all the probable and presumptive signs of pregnancy. These people, they may even end up with false labor pain. They will experience labor and they will not get any baby. So this is pseudocyesis. Next, what we have is unconscious pregnancy. Here they are actually pregnant. They are actually pregnant, but they will not experience any symptom. There will be no symptom, and all of a sudden they will deliver a baby. This is something known as unconscious pregnancy. Pseudocyesis, no pregnancy, but symptom will be there. Unconscious pregnancy, it is actual pregnancy, but symptom will not be there. And if a patient, if it is an accused and they are under capital punishment, they are going to die. In such cases, if they become pregnant, it will be delayed till they deliver the baby. So, till the mother deliver the baby, even if she is going to be killed by capital punishment, they will wait till the baby is delivered. Only after that they will be commuting the capital punishment. So, these are the important aspects of pregnancy. And there is one more thing known as superfetation and superfecundation. This is very, very important and it can be asked. So, first thing you have to remember, in fecundation there is C. So, this means in one cycle there will be release of 2 ova, and these 2 ova will be fertilized by 2 sperms, 2 different sperms, and eventually you will get 2 fetus of same age. This is superfecundation. So, in a single menstrual cycle, 2 ova will be released, and this 2 ova, it will be separately fertilized by 2 different sperms, and there will be 2 different fetus and they will have same gestational age. This is superfecundation and this is seen in human. But the superfetation, here what will happen is that there will be 2 ova from 2 different cycle. So, after some interval, these another ova will be released and these two ova will be fertilized at different times. So, at different time you will get fetus. So, the age of the fetus, it will be different. So, this is known as superfetation and this is very rarely seen in human, and this superfecundation and fetation difference, it is very important. So, first thing, pseudocyesis, it is false pregnancy. Next is unconscious pregnancy where they don't feel any symptom but still pregnant. Then capital punishment will be delayed if the mother is going to deliver the baby. And superfetation, you have two different cycle, two different ova, two different sperm and two fetuses with different age. Superfecundation, single cycle, two ova, two sperm and two fetuses with same age. So, the criteria, the differing criteria is the age of the fetus. By looking at the age of the fetus, we can identify whether it is superfetation or superfecundation. So, this is the important thing about this delivery. Now, there are signs of recent delivery that we have to see. So, mostly the immediate changes that you will be seeing in the local area, like local area changes. There will be congestion, there will be some tear and there will be some bleeding. Everything will be seen in the genital region. Apart from that, abdomen, it will become very flabby abdomen, and you can palpate the uterus and its size will keep on reducing. It will reduce by 1.5 centimeter per day. And immediately after the delivery, it will be seen 3 centimeter below the umbilicus. It will be really hard ball-like structure. And after that, it will keep on decreasing in size and by 9 weeks, it will return to normal size. And you can get to see something known as lochia, which is nothing but a discharge. So, you can remember RSA. Initially, there will be rubra, then you have serosa, then alba. So, this will be red, serous and white discharge. By looking at this discharge, you can identify the delivery had happened and what is the time of delivery. All these things we can identify. Next, what we have is cervix, labia and vagina. There you can see some tear and congestion. All these things are common in this thing. So, these are the signs of recent delivery. And in case of death, all these things, all the signs that we have seen above, it is seen. Apart from that, you can see the uterine cavity which is obliterated. So, uterine cavity would be obliterated and you can visualize the placental site where the placenta was attached. There you can see some irregularity. So, this will help us to identify that it was a recently delivered uterus, and overall congestion of the uterus and tubes will be seen. So, these are the changes that normally happens in the delivery. Now, we have to know about artificial reproductive techniques. So, this artificial reproductive technique, you have artificial insemination and you have test tube babies, that is your fertilization in vitro, IVF babies. So, these are the two artificial reproductive techniques that is used in our country, and for doing both of this, we need consent of spouse. Like both the husband and wife, they have to give consent. And where we do this artificial insemination. So, artificial insemination, the indication is if the husband is impotent, we will be doing this artificial insemination, or if the wife is having any cervicitis or unfavorable cervix we will be doing this artificial insemination, and most commonly the impotence of the husband, it is psychological, and we can find out whether it is organic or psychological by doing penile erection test. So, nocturnal penile erection test. So, at nights there will be erection happening some 2 to 3 times. If it is happening means there is only psychological impotence. If it is really organic impotence, this nocturnal tumescence will not happen in the male. And to find out any organic causes, what we have to do is, we have to do Doppler study. And this is very, very important in the diagnosis of the reason for impotence in male. Now, what they will do in artificial insemination is that they will take the sperm of the husband and they will introduce into the cervix. The vagina they will introduce, and this is known as artificial insemination homologous. Artificial insemination homologous. If the husband is having azoospermia or oligospermia, what they will do is, they will take from the donor. Donor sperm is used. This is artificial insemination donor. Sometimes what they will do is, they will use both. So, both sperm are used for artificial insemination, and these are the artificial insemination techniques that is commonly used, and the child that is born through this fully legitimate. It has all the rights as a normal biological child. So, this is very, very important. This is artificial insemination. In case of IVF, what will happen is that they will fertilize in vitro, that is outside the body. They will fertilize the egg. They will take out the oocyte by stimulation, and they will take out the sperm, and they will fertilize, and they will implant embryo after 3 days inside the uterus. So, this is IVF. So, these are the artificial reproductive techniques, and these techniques, especially this IVF and all, it is used in posthumous child. So, posthumous child is when the child born after death of the biological father. So, this is known as this posthumous child. Mostly they will be storing the sperm, and after the death they will do IVF and they will have the baby. This baby is known as posthumous child. So, these are the artificial reproductive techniques, and these are being done nowadays, and all the babies that is coming out of this technique is fully legitimate. So, next what we have is virginity. So, virginity, it is a very old concept. So, according to the textbook, what is that? Like, a girl is considered virgin if there was no sexual intercourse, and if her hymen is intact. This is virgin. Deflorate means there had been intercourse and the hymen has ruptured. False virgin means the hymen is intact even after intercourse. So, these are the different terms: virgin, deflorate women and false virgin. And this rupture of hymen, it is usually done in the intercourse, and it is usually seen in the posterolateral aspect. Posterolateral part of the hymen, you can see the rupture, and it is also ruptured because of poor hygiene, some horse saddling and few other violent exercises. It can result in rupture of hymen. So, even if there had not been intercourse, there is possibility the hymen could rupture. So, when you want to differentiate a nulliparous from a multiparous woman, what you can do is, you can compare their uterus. So, in uterus, you can see these differences. The body will be same as the cervix. But here in multiparous, the body will be twice the length of the cervix. And the top of the fundus is less concave, while here it is very much convex. And concave and the cavity of the uterus, it will be very smaller and triangular, while here it is wider and more round. And external os is rounder and orifices are closed. Here it will be transverse and orifice admits tip of the finger. Internal are circular and well defined, and here it is not well defined. And cervix, it will be showing very regular with no scar. Here there will be lot of scar and irregular appearance. So these are the things that will help us to differentiate a nulliparous uterus from a multiparous uterus. So with this we are completing this chapter. So the pregnancy, what you have to know is the probable signs, positive signs, presumptive signs, and what is this virginity, what is this artificial reproductive techniques. All these things are important, and pseudocyesis, posthumous child, that is also important. So thank you for watching.